In hospitals, surgery is one of the highest risk clinical processes. If surgical services are not properly structured, it can lead to serious patient safety incidents such as wrong surgery, wrong site surgery, surgical site infections, anesthesia complications. These events can severely affect patient safety and hospital reputation. That is why NABH introduced the COP 14 standard, which ensures that surgical services are safe, standardized and well controlled. What you will learn in this video. In this video we will understand what NABH COP 14 standard says, what assesses check in operation theatre, OT, common NABH non-conformities. How hospitals can become COP 14 compliant. Let's begin. What is NABH COP 14 standard? The COP 14 standard states, surgical services are provided in a consistent and safe manner. This means hospitals must ensure that surgical services are delivered through standard protocols, competent surgeons, safe OT practices. This ensures safe surgical care for patients. Objective elements of COP 14. COP 14 includes the following key elements: standardized surgical services, pre-operative assessment, surgical informed consent, prevention of wrong surgery, operative note documentation, post-operative care plan, infection control in OT, adequate OT facilities and equipment, OT quality assurance program, OT environment surveillance. During NABH assessment, these elements are verified through OT observation, surgical records, staff interviews. Standardized surgical services. Hospitals must ensure surgical services are delivered in a consistent and standardized manner. These services should follow standard treatment guidelines, evidence-based clinical practices. Hospitals must also clearly define list of surgical procedures, surgeon competency levels, surgeon competency. Hospitals must define which surgeon can perform which type of surgery. This is usually managed through the clinical privileging system. Clinical privileging ensures that only qualified surgeons perform specific procedures. Pre-operative assessment. Before surgery, pre-operative assessment is mandatory. The assessment may be performed by the operating surgeon or a member of the surgical team. The patient record must include pre-operative diagnosis documentation. Pre-operative instructions. Before surgery, patients and families must receive clear instructions such as fasting instructions, medication instructions. These instructions help prepare the patient safely for surgery. Informed surgical consent. Before surgery, informed consent must be obtained. While taking consent, doctors must explain procedure details, risks involved, expected outcomes. If the patient's condition changes before surgery, the patient or family must be informed. Documentation must be done. If an additional procedure is required during surgery, fresh consent must be taken. Exception: life-saving emergency procedures. Prevention of wrong surgery. One of the core NABH patient safety requirements is preventing wrong patient surgery, wrong site surgery, wrong procedure surgery. Hospitals must implement systems such as patient identification verification, surgical site marking, cross-checking procedures. Surgical site marking. Surgical site marking must be clear, recognizable, consistent. Site marking is mandatory when laterality is involved, multiple structures are involved, spine surgery is performed. The marking must be done by the operating surgeon. Surgical timeout. Before starting surgery, a surgical timeout process must be performed. During timeout, the surgical team confirms correct patient, correct procedure, correct surgical site. This is a critical patient safety step. Operative note documentation. After surgery, an operative note must be documented. This may be written by the surgeon or a surgical team member. If documented by a team member, it must be countersigned by the chief surgeon. Contents of operative note. Operative notes should include surgery performed, surgeon name, anesthesiologist name. Additional details include post-operative diagnosis, intra-operative findings, blood loss. Documentation should also include key steps of surgery, peri-operative complications. Post-operative care plan. After surgery, patient care must follow a documented post-operative plan. This plan may include IV fluids, medications, wound care, monitoring for complications. Proper planning ensures safe recovery after surgery. Infection prevention in OT. OT practices must follow infection prevention guidelines. Examples include sterile material handling, separation of sterile and non-sterile materials, Proper OT design must also ensure that sterile and non-sterile material flow remains separate. OT facilities and equipment. An OT complex should ideally include pre-operative holding area, changing rooms, hand-washing area, operating rooms, recovery room, waiting area for relatives. OT must also have essential equipment such as surgical equipment, anesthesia equipment, resuscitation equipment. OT Quality Assurance Program. COP14 includes an achievement element requiring an OT Quality Assurance Program. Hospitals must monitor OT quality indicators, such as surgical site infection rate, deep vein thrombosis, DVT, incidents, intra-operative mishaps. Examples of mishaps include cautery burns, patient falls, position-related nerve injuries. OT environment surveillance. Hospitals must monitor the OT environment regularly. Daily monitoring includes temperature, humidity, pressure differential. Additionally, OT air filter integrity must be checked at least every 6 months. Common NABH non-conformities in COP14. Common assessment observations include surgical site marking missing, timeout process not implemented, operative notes incomplete, post-operative care plan not documented, OT environmental monitoring missing. Hospitals should address these issues to avoid NABH non-conformities. How hospitals can become COP14 compliant. Hospitals can comply with COP14 by developing surgical SOP, implementing timeout procedures, improving operative documentation, strengthening OT infection control, monitoring OT quality indicators. These steps help hospitals effectively comply with NABH COP14 standards. In the next video of this NABH training series, we will discuss COP15. Organ transplant program is carried out safely. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.